So, Deacon Ed, it's great to see you. Thanks for joining us this evening. Uh, could you give us a brief overview of the Association of Catholic Mental Health Ministries, which you founded?
It's a group of Catholic ministers who have gotten together to form a network to support each other. We decided to do this a couple years ago because there aren't that many of us in this ministry yet in the Catholic Church, and I would emphasize the word yet. But we found it's important to be able to share resources with each other, share information, and to build up this ministry within the church. It can be a lonely ministry at times, so we need to support each other and network with each other.
So, Deacon Ed, I'm asking everyone this, but on a more personal note, how have you been caring for your mental health and well-being in the past year?
Well, I struggle with moderate levels of depression. So for me, it's being aware of it, acknowledging that I have to be aware of my depression, and take notice of the signs. So once I do that and feel the depression coming on, and it can manifest itself as being either sad or tired or being a little edgy, a little angry, I get exercise regularly. I try to watch what I eat. I do all the things that you should do, and take some medicine to help manage it. I've just been just paying more attention to it and viewing it as an illness and not just simply as me being grumpy or tired, but realizing this is an illness I need to pay attention to.
Wow. Yeah, no, thank you for sharing. It's so helpful. You know, our gala theme this year is entitled In My Shoes. So, from your perspective as a ministry leader, what are the benefits that can come from sharing our mental health journeys with others?
It's important that ministry leaders open up about their mental health issues so that we're not viewed as somehow separate or superior to the people in our parishes. And because that increases the stigma. If somehow it appears as though the people in ministry don't have to deal with mental health and mental health challenges, does that make the other folks lesser than because they do? I mean, the reality is we all have to deal with these mental health challenges. And I think that by us opening up and making it clear that we all experience this thing, it's something that reduces the stigma, reduces the discrimination, reduces the self-stigmatization, and makes people more comfortable to bring it out into the open, to discuss it with their church faith leaders, and it opens up, and I believe ultimately that opens up, gives an opening for Christ to enter into this discussion and be the source of compassion that Christ, I'm sure, wants to be in the midst of all of this. And so if we can break down those barriers and allow the doors of the church to swing open wide, so to speak, and let Christ's healing balm enter into the lives of people that live with these illnesses, that's a wonderful thing that we can do.
So good. So, Deacon Ed, it's a rather serious note to strike on as we close our time together in this interview, but it's a question that I really think needs to be heard. Deacon Ed, there may be people attending our gala tonight who have lost a loved one to suicide. What are some words of hope that you would like to convey to them this evening?
Well, the one word of hope is that your loved one has not disappeared. It's not like they no longer exist. Your loved one is fully alive, still exists, and perhaps in a more glorious state, certainly in a place that's closer to God than any of us here on earth are. So always remember that. Us Catholics use the phrase the communion of saints, which means that there's those of us that are living and the dead, we're all still joined together. So in my experience with Katie, I still experience Katie. I know she exists. I pray with her, and she has by no means disappeared off into the ether. She still very much exists. And the second thing is that God can turn everything to the good. And as hard as it may be to understand how God can use suicide to the good, I know my experience is that it's made me a more empathetic person. I understand suffering better now, and that God can somehow turn that to the good. I always say that, we can bring the joy that our loved ones had into the world, but we can also take their suffering and turn it into service to those who suffer from the same thing. So in my case, and in the case of many other people, we can bring the love of service to those who live with a mental illness and those who are grieving a suicide. We can be of help. We can love them and show them that God never is far from them.
Amen. Thank you so much, Deacon Ed. Thank you for joining us this evening, and thank you for our continued partnership. We are thrilled to be working with you.
And we are too. It's going to be great. Thanks.